Your child was speaking. They were saying words, making eye contact, waving goodbyes, and then the words stopped coming. What you witness has a name. It's called regression. And in children with autism, it's far more common than most people know. Regression means a child loses skills they once had: words, eye contact, toilet training, social connection. In typical children, mild regression happens occasionally, usually during stress. In autistic children, it's different. Around 1 in 5 autistic children experience regression. Compare that to just 2% of neurotypical children. It is not rare, it is not a failure. This is a recognized part of how autism can unfold. Here's what regression actually looks like. Words and sentences fade, speech becomes more repetitive, less communicative. Research shows 77% of children who lose language also lose gestures and eye contact at the same time. Less response to their name, less interest in familiar faces, less connection. Toilet accidents after months of being trained, baby talk, sleep disruption that had resolved. Struggling with tasks, dressing, feeding, they had already masters. Every parent asks this first. And I want to be clear, regression is not caused by parenting. Research has confirmed it's not linked to anything a parent did or did not do. The autistic brain develops differently and not always in a straight line. Skills that she seemed established may not have been as consolidated as they appear. Emerging research links regression to immune differences that affect brain regions responsible for social processing. New school, house move, disrupted routines. For autistic children whose nervous system are already working harder, big changes can push the system past its limit. Burnout happens when an autistic child has spent so long masking, suppressing their natural responses to appear neurotypical that the system collapses. It's not a breakdown, it's exhaustion. Now, the part I most want you to hear. Research shows that 43% of children who experience regression regain the skills they lost after an average of 19 months. Nearly half. With time and the right support. Regression is not a cliff. It is a dip in a longer journey, and the direction of the journey is still forward. If you're seeing regression right now, 4 things. Document what you are seeing, rule out medical causes, reduce demands, give the nervous system space to recover, and connect with a specialist who understands autism. Your presence through all of it matters more than any intervention. A child who feels safe, seen, and not alone has the best possible environment to come back to themselves. Regression is frightening to witness, but it is not the end of the story. Your child's brain is still developing, still capable, still reaching, even when it does not look that way from the outside. Share this with a parent who needs it today. Subscribe for more. I post every week. I am Shalini. Take care of yourself so you can take care of them.